Thank you very much. And on behalf of the group in the room, I have to say that even though I've heard some bits and pieces of all of your presentations, it's truly inspiring to know the innovation that is going on and to have us move from the traditional models of leadership, from tell, sell, share, consult, to co-create. And I think that that's very much reflected in what we've all experienced here today. The collaboratives would like to thank the IOM and the Global Forum for actually giving us this opportunity to leverage the work that perhaps we may not have done, or it might have happened organically, but in fact has driven us to make some political change within our own environments. I'll just have a couple of reflections and then open up to questions. And as a procedural note, I'd like to offer Juanita the first chance to speak because she's on Skype, and then move down the table or direct your questions to anyone in particular. A key issue for what we've learned through what we've seen all the collaboratives are doing, and I should mention that the Ugandan Collaborative is actually addressing professionalism within the leadership paradigm, targeted predominantly at students, at early practitioners. You've seen that there's a spectrum of types of individuals or groups that have been identified by each of these collaboratives, but there's a common theme, which is what was brought out by the Lancet report. Whatever we decide, if we don't have the enabled and mobilized leadership to be able to recognize that vision and then to take it forward and make that change, it's likely that we're spinning our wheels talking about it, but not actually incrementally probably taking it forward. But the kind of disruptive innovations that we need require courage, conviction, an ability to embrace uncertainty and complexity, and also to be able to collaborate. And as Maria pointed out, I think the theme from all of us, even I'm looking at Juanita's slide, is character. So that might be 5 C's, I'm not sure, but the 5 C's of collaborative leadership. Two other points that have emerged for us, certainly in the Canadian Collaborative, but I think certainly in the Indian Collaborative as well, is that a government imperative, and I think also a social imperative in South Africa and Uganda, one that drives it, is the one that reaches a critical point where either the public or society through its government have expressed the view that you heard, in fact, yesterday, that they are, I can't paraphrase the words from that movie, but they're tired as heck and they don't want to take it anymore, right? So to get to the point where, in fact, I suspect we're on the cusp of a spring, a form of spring of public demand, perhaps not right now, but within the very near future, and not to be poised to be able to address the demands of that spring for reform is a challenge that I put to you. So as you frame your questions, think certainly about what change agents are within your own environment and what they mean to you and what leadership means to you. But let's open it up for questions. We have a little over 15 minutes. Yes, hi, Lucinda.
How can a forum help each of your collaboratives expand to other disciplines? And what are your plans for expanding to other disciplines over time?
Juanita, do you want to start? The question is, how can the forum help the collaboratives expand to other disciplines, especially over time?
Other disciplines being... Hello?
Did you hear the question?
I'm not sure what is meant by other disciplines.
I think we're having some technical difficulties. Do you mind if we move on to the rest of the panel?
Okay.
Okay. Does anyone want to take a crack at that? Maria?
Thanks for your question, Lucinda. I'm not sure that it's so much about expanding to other disciplines, because certainly our program is rooted in an interprofessional approach to leadership. But I do think there's an enormous role in terms of helping us to translate the learnings to different contexts. So while our work is Canadian work, we really want to be able to think about how do our learnings apply, how might they inform other contexts, whether they're geographical or cultural. So I think having those kinds of conversations here would be extremely helpful, as well as thinking about how the integrated learnings across the collaboratives can inform the work of the forum.
Marika? Marika, did you want to? No? Sanjay?
Uh, the participation in forum meeting itself has been extremely helpful. Like for example, now because last month only we tested a model which we developed actually for training of in-service health professionals, and the all issues surrounding interprofessional leadership are being covered actually. But my colleague and I was discussing yesterday morning, we didn't talk about professionalism actually as a part of the program basically. And if you see, and so we thought that immediately one thing, and that it came out of the feedback also, and so this is useful. Like, and then trying to now, we thought that probably we need to incorporate professionalism as a part of the program. So all those 3-4 meetings actually have been extensively. More important is that all the collaboratives, formally and informally, we have been in touch with each other actually, and sharing has been always useful. So that's a platform that's provided, has been extremely useful.
I'll take a crack at it from my point of view, which is I've been able to, as Sanjay just said, sort of traverse across the collaboratives and understand what is happening. There are some common themes here. I don't think the skills that we're describing would be specialty or discipline specific. In fact, the skills that require someone to be collaborative and inclusive, to develop interdependence, to balance life, to balance the uncertainty and manage the traversing from hierarchy. Our systems are very hierarchical and very militaristic in their setup. But to be able to actually deal with conflict management and then to move forward, as we've coined, I think, in some of our work, the ability to ask the wicked questions. And you may not be able to get the answers, but to be able to actually challenge the system, to be able to say, well, why aren't we doing this? I think those are common skills. How can you help us? We have now, amongst all of us, begun developing a curriculum or 4 curricula and 4 approaches that are somewhat unique. They're not culturally specific, I don't believe. They're actually quite transferable. And we would like very much to have the opportunity to have the chance to showcase them to you, share them with you, use you as possibly our pilots, but indeed voluntold some of you to be able to demonstrate the efficacy of our programs. And I think there would all be lots of interest amongst many of your organizations to do that at an international level, to show that in fact these are knowledge dissemination, knowledge transfer, knowledge application, and sharing of the knowledge economy that is truly global.
Hi, Richard Murray, Australia. Look, collaborative leadership for transforming health professional education so as to better meet the priority health needs of population is important. The difficulty is that I guess the extraordinary resistance of established institutions to cultural change, and culture eats strategy for breakfast. So how do you, one of the difficulties is do you apply this in a new school or a new institution or a new program setting? And there's a set of skills around that, you know, the greenfield site, if you like, and doing things anew, as opposed to transforming an established megalithic, sort of institution that has its own deep roots and values, and that's actually very difficult to transform.
Well, I mean, yes, Marika.
Thank you, Richard, for that question. Maybe I can just speak from my own experience. Recently, we wrote up a chapter for the WHO about the development of our community-based education strategy. And going back where we started when community-based and family medicine and those things were not things you talked about. And looking back over the years, there were a few common themes, and that is that if you believe in something and you want to innovate, if you lead that with integrity, and my motto is persistence, perseverance, never give up, but taking the people with you, and then having the opportunities to start a new thing, a small thing, in an old school, and then taking that innovation back to the other people, which by that time is so interested in what you do, they want to adopt it. So it's a kind of a I think if you look at the leadership around that, it is believing in what you do, work with the people that are with you now, but respect the other people for their views. And along the way, they will join you.
Maddie.
I'd like to build on that remark and to say that I think one of the issues that we need to keep moving forward with is taking what you've identified and doing more drill down, so that if, for example, take conflict management. Well, what are the conflict issues when we put a diverse group of health professionals together to work? And one of my favorite articles is an article by Mary Dombeck, where she develops the notion of professional personhood and talks about the need to exhibit tolerance. And tolerance not in a superficial sense, but in a sense that respects the fundamental ethical principles and practices that each of our disciplines teach. And recognizing that conflict emerges because we honestly, from our own professions, have different perspectives on what's right. And so when you try to address conflict management from a leadership perspective in the context that we're talking about, one of the characteristics that needs to be exhibited is tolerance. So I think that taking the general principles, which are wonderful ones that you've surfaced, and then doing the drill down to say, okay, so what do these things look like when we try to collectively work together is part of where we need to go. We need to keep pushing further.
And I just wanted to reflect a little reaction I had, which is I think I've often heard that culture trumps strategy, but I think that our views, certainly the Canadian view, is that social responsibility trumps culture. Yes, John.
I think to drill down on one of those characteristics, I noted that in the South African environment you talked about, I think it came up as balanced life. And then Canada, I think the language was self-awareness and self-reflection. I know in the complementary and integrative community, the conflict between people, like most of us, working too many hours and not exhibiting the practices that we're trying to promote of health in the community is a big continuing issue. And for practitioners, the idea that if we're going to move to a health-focused system, that the practitioners themselves need to be deeply engaged in their own health processes. And so my question to you, I'd just love to see you in either of those environments kind of break out a little bit more how these concepts of balanced life and self-awareness came into your interviews.
Juanita, do you able to comment on that?
Yes, is everything fine now?
Yes.
Okay. I think part of what we found is perhaps a bit theoretical, because these people that were interviewed are the ones that work too many hours and spend weekends doing their work, but they also said that we need a balanced life. And perhaps some of that is a desire to have a balanced life, more than actually practicing the balanced life. But there was a definite consensus that for them a balanced life is the acknowledging that there is the work, but that there is also the family, the social environment, the health environment, and that they actually should take care of themselves in all of those aspects. And also because the concept of role modeling and mentorship came across very strongly, I think there is a realization developing that it's no longer enough to talk about having a balanced life, but actually role modeling the balanced life.
Maria, did you want to comment about the developmental aspect of the evaluation and how that might actually inform the program?
So, yeah, absolutely. And so first I'll say very much aligned with the comments we've heard from Juanita, but I think for us in our work, the notion of pause has come up a lot in the scholarly work, but also in our approach to evaluation, which is Patton's work on developmental evaluation or emergent evaluation. And so this need to actually pause and reflect. And in a way, we've lost that in the culture of healthcare and health education. So as a leader, part of practicing that self-care is to pause, to look at what's working, asking those wicked questions around what do we build on, what do we stop doing, where do I need to go to continue to have my passionate purpose as a leader, how does the work need to shift and change. So this notion of pausing, reflecting, adapting, I would say is very much linked with your question, John, and is very much reflected in both how we imagine developing our content, but also in terms of how we're evaluating the program.
Emmanuel?
And this process has to be iterative through the process of making decision, create the shared vision, and after evaluate their impact. So the evaluation and reflexive question are there to help the people keeping involved in the process and always evaluate our own processes and impacts.
One of the risks of leadership programs is, in fact, that they identify that the candidates must perhaps acquire all of this knowledge, skill, and attitude in order to become superheroes. So that if you aren't able to achieve all of that, that there's something wrong. You can't manage the uncertainty, or you haven't been able to manage the life-work balance. And I think this issue around reflection, pausing, and being able to forge should not be seen as a soft skill. It's actually one of the fundamental skills. We're going to give the last question to Patricia.
Yes, I wondered, Maria, when you were talking about the review of the literature that you did, if there was anything that showed up in emotional and social and emotional intelligence. Because what's striking to me is of all of the terms that you've mentioned, the self and other awareness, the agility and rapid change, the collaboration, conflict management, development of leaders and mentoring, the integrity, actually it uses the term authenticity, and perseverance. Those are some of the 26 competencies that are in the social and emotional intelligence framework, regardless of what instrument you use. And so I'm just wondering, when we look at that collaborative leadership role, because business and industry has already taken successful leaders and knowing that if you can train and move towards social and emotional intelligence, that you can enhance, if you will, a successful leader, because depending on the literature that you read, either 20 or 30% of our expertise is really what contributes to our success, and 70 to 80% is social emotional intelligence. So I'm curious if when you looked at the literature review, if that was a theme or a model that showed up, because it's clearly out there in the training in industry more than in academia.
Emmanuel, did you want, or you've done a lot of work on that?
Concerning the literature review of the existing program, effectively this aspect is very present, but always in the individual level. So we have to develop our own emotional intelligence, and we think as the CIHRC that we have to go further than that and bring these principles of individual emotional intelligence to the collective level and learn how to create this collective intelligence.
And maybe I'll just add to that, and Sarita's said a little bit about the notion of asking wicked questions or asking learner-oriented generative questions. I think that's the piece that we could add to what we found in the work around emotional intelligence, is always taking that learner stance and really adopting a stance of curiosity.
So just before we close, find out if Himanshu or Sanjay or Marika, you wanted to add any final words?
Yeah, can I just add something specifically for John? What we're now doing is developing a joint short course with the Mindfulness-Based Institute of South Africa on a course for mindfulness-based learning, stress reduction, all of those things. We've actually started it amongst the family physicians working in the health districts And that we see as one of the ways that we can come to these things you're talking about.
One of the bits that we keep on struggling with constantly is in terms of when we're talking about simple innovations or even teaching leadership through innovation, there is no way that we can mandate it across practice or across through health systems. These have to be collectively formed over time. What we are trying to attempt to do through a training model is probably set stage for some internal discussions or for this actual idea to bloom across within the health system as a whole. This is going to be a fairly long drawn process. And if it's going to be long drawn, just as Emmanuel pointed out, as to how do we measure, what outcomes, how do we quantify, have we done something even through this model that's substantial or not, is going to be really, really tough for us to even address.
Well, thank you very much. And Juanita, I want to thank you for joining us. I don't know if you're staying for the rest of the session, but apologies for the technical difficulty, but your contributions were marvelous. Resilience has been described to me by someone as how high do you bounce when you hit the ground? What's your bounciness? My bounciness usually wanes after 2 or 3 days of sitting in a room because I'm numb by that point. But I hope that you found our description of what our programs are doing helpful. We are delighted to come to every workshop and share them with you. I think we've all reached the point where we're ready to actually, in the next workshop, demonstrate some early results, if not at least a program that we'd like to present to you. And anything that you can do to help us take that forward and leverage it up to less than country-centric and more to a global environment, we're delighted. And we really, again, once again, thank the IOM and its sponsors for giving us the opportunity to participate as an innovation collaborative. Thank you.